Hi, and thank you all for joining me for Supervision Sundays. I am Dr. Brittany. I want to take this opportunity to remind you all, if you are not following the business page on Instagram, Twitter, or Facebook, to please do that. Please like, follow, and share. It is at Lead Clinically. And so that is on Instagram, it's at Lead Clinically. On Twitter, it is at Lead Clinically. And on Facebook, it is facebook.com/Lead Clinically. One of the goals for this vlog is that I provide you all with some helpful information for your clinical practice. There's a lot of research that supports the importance of continuing supervision, not just during the time that we are registered interns. And my goal is that I provide you all with information that helps you go over and beyond the minimum standards that your agency may be providing to you or requiring of you to complete your clinical work. And so the topic of today's vlog is really focused on outlining the clinical criteria when you assess someone. And so when we decide, hey, we're going to give someone a diagnosis, oftentimes we just kind of give that DSM code and we give the actual diagnoses. But we don't always express like what symptoms were met to meet that diagnosis in our clinical assessment. And so today I want to talk a little bit in depth about that and provide you all with some examples. And so for the first example, we're going to use major depressive disorder. Keep in mind that the DSM-5 requires that that individual has met 5 or more of the symptoms within the last 2 weeks. And so for those of you that really like to dig deeper into an individual's childhood, that's absolutely perfect. You want to continue to do those things. But you also want to make sure that you're able to justify what symptoms were met within the last 2 weeks. And so those criteria include being depressed most of the day, a diminished interest in usual activities. It could be weight loss. They may experience fatigue. They may have feelings of worthlessness or hopelessness. They may experience problems concentrating. They may have recurrent thoughts of suicide. So you want to make sure that when you're writing that up, you outline which of the criteria were met in the last 2 weeks. And so you want to be specific and intentional with your clients by asking that, right? So your client may share with you that, I've been feeling depressed most days for the last 6 months. And so that's great, but you want to really narrow it down and hone in on what life has been like for the last 2 weeks. The reason you want to do that is, in my clinical experience, you can get into a clinical chart where you are inheriting a client. And so you say, okay, well, this person has been diagnosed with bipolar disorder, but I'm not really sure that I am seeing that. And so what it does for you is if you are transferring that client or you're inheriting the client, it allows you to see what criteria that clinician believed was met at that time of assessment, to allow you to go, okay, well, this is what they were seeing. Do I truly see those things, right? It also assists you in developing a treatment plan. So if you're working with an individual and you say the one symptom that they're experiencing is fatigue, right? Or problems concentrating. Well, when you're developing a treatment plan with that individual, it enhances your ability to truly work on that particular symptom and reducing those symptoms. And it helps you kind of stay on track when you're outlining what you're seeing. It also holds you accountable, right? Because oftentimes we think, I really believe that the individual is experiencing a depressive disorder. And so you go maybe into the DSM and you look and it says, hey, you need 5 symptoms within the last 2 weeks, but you're really only coming up with 3, right? And so we don't want to misdiagnose someone. We don't want to overdiagnose them. We want to really make sure we're seeing what is required. It also helps you to become a little more familiar with the diagnoses. And so my last vlog, I talked about us being intentional and getting into the research, getting into the literature, and getting into the DSM and really understanding what is required for most diagnoses. And so it helps you when you can outline, okay, this is exactly what this particular client met at the time of my assessment. And so when you're reassessing them, maybe in 6 months or maybe in a year, you can look back and say, okay, are they still presented with that same diagnosis? So I'm going to provide you all with an example of what that looks like when you write it up, right? And so I'll share it on the screen momentarily, but what I'll say is what you want to do is you really just want to say, client met the following diagnoses based on self-report, based on collateral information, based on information that they brought into the session, whether that be court documents. They may not always endorse it verbally, but you may be able to see it on how they present, or you may be able to see it, let's just say they had an individual come into the session with them, so it may be collateral from maybe a family member. And it may be collateral from a child welfare referral. And so what you want to do is say, based on the information that was available at the time of the assessment, client meets the diagnostic criteria for such diagnoses, major depressive disorder, as evidenced by the following endorsed symptoms, and then you're just listing out the symptoms that you believe from the DSM that individual met at that time. And what it looks like when you write it is this. You can do the same thing with substance use disorders, and so the alcohol use disorder requires that an individual meets 2 or more within the last 12 months. So again, you're paying attention to what life looked like the last 12 months. Super important to get that history. You may be assessing for the adverse childhood experience that the individual has had, you're assessing for trauma, and so those things are still important. However, if you're going to give someone a substance use disorder, you want to make sure that they're meeting the criteria, right? So that individual may be experiencing tolerance, they may have had unsuccessful efforts cutting down on their use, they may have had urges, and so you're really looking at, okay, how many of the symptoms outlined in the DSM does this individual meet? So I'm going to share with you all what the diagnostic criteria is from the DSM on my screen. So again, when you're writing it up, you really just want to say, based on the information that was provided in your session, your assessment, okay? And so based on the available criteria, whether that be you did a standardized tool, again, collateral information, client meets the diagnostic criteria for alcohol use disorder as evidenced by the following symptoms. Now, keep in mind, for some diagnoses, they do indicate whether you do have to indicate whether you're identifying it as mild, moderate, or severe. And so if we only identify that there are 2 criteria met, that individual may have a mild alcohol use disorder. And so when writing it up, this is what you want it to look like. And so again, I recognize that your agencies or insurance panels may not be asking you to outline it in the way that I'm suggesting that you do it. However, what I will say to that is that my goal, again, is to go beyond the minimal standards. It really helps you to hone in on what you need to work with the client on, and it also helps you with treatment planning. And then if you are transferring the client or if you're inheriting a client, the more individuals really outline what criteria are met, the better the treatment is for the client. And our goal overall is always to make sure that individuals get the treatment that they deserve and that they're seeking, and that it is not just evidence-based, but that we're not misdiagnosing them so that they can get the right treatment at the right time. And so I'm definitely interested in your feedback. Please, let's keep the conversation going down in the comments. I hope that this was helpful to you. If you have questions, I will do my best to respond to everyone and to provide you all with feedback. Again, if you are already following, liking, and sharing, I really appreciate your support. You all have been super amazing and super supportive, and I just want to say thank you all. Thank you for taking a time out to just listen, just to share and give your feedback. Again, #Supervision Sundays. Like, follow, share. Thank you.